From lab benches to spice racks, the journey of herbs like rosemary and sage has taken a fascinating turn, one that's increasingly drawing the attention of neuroscientists, pharmacologists, and doctors. For centuries, these plants were prized for their aromatic qualities and folk uses, often dismissed by modern medicine as quaint but unproven. But over the last 2 decades, rigorous laboratory research has uncovered a wealth of bioactive compounds within these herbs, compounds that do far more than add flavor to roasted potatoes or holiday stuffing. In fact, they're now being studied for their ability to protect the brain from aging, inflammation, and even neurodegenerative diseases like Alzheimer's. What was once kitchen folklore is quickly becoming the subject of peer-reviewed journals and early-phase clinical trials. Take rosemary. Long associated with memory in literature and ancient rituals, rosemary for remembrance, this herb now has scientific backing for that very claim. One of its key compounds, carnosic acid, is what researchers call a proelectrophilic molecule. That means it remains mostly inert until it detects oxidative stress in the brain. Once triggered, carnosic acid activates the NRF2 pathway, a master switch for cellular defense systems that ramps up production of antioxidant enzymes, protects mitochondria, and calms neuroinflammation. These mechanisms aren't theoretical anymore. They've been repeatedly demonstrated in cell cultures and animal models, where rosemary extracts have been shown to reduce amyloid beta accumulation, preserve synaptic health, and even improve performance in memory tasks. That's serious stuff for something you can sprinkle on focaccia. Building on this lab work, researchers have begun testing rosemary-based formulations in early human trials. While the sample sizes remain small, preliminary studies using carnosic acid-rich extracts show promise in individuals with mild cognitive impairment, MCI, the precursor to dementia. These studies often measure changes in cognition, biomarkers of oxidative stress, or inflammatory markers in the blood, and while they're not blockbuster results yet, they're consistent enough to keep funding and interest alive. Scientists are also exploring stabilized, semi-synthetic versions of carnosic acid to improve bioavailability and shelf life, pushing rosemary from supplement shelves toward potential prescription territory. Sage is on a similar path. Often associated with clarity and calm, sage contains a cocktail of compounds that influence neurotransmitters and protect brain cells. Chief among them are rosmarinic acid, luteolin, and ursolic acid, which help regulate inflammatory cytokines, fight free radicals, and inhibit enzymes that degrade acetylcholine, a neurotransmitter central to learning and memory that sharply declines in Alzheimer's. In fact, some of sage's mechanisms closely mirror those of donepezil, a common Alzheimer's drug, but with fewer side effects and broader antioxidant benefits. Several human studies have now tested standardized sage extracts, and the results are encouraging. One randomized, double-blind study found that adults taking a sage supplement showed improved memory recall and attention within hours of dosing, suggesting both acute and long-term cognitive benefits. In elderly individuals with MCI, sage extracts were associated with improvements in word recall and processing speed over several weeks. Some trials also noted reductions in anxiety and improved sleep, an important bonus, considering how tightly mood, sleep, and memory are interwoven in the aging brain. The translation from lab to clinic isn't always smooth. Natural compounds often suffer from issues like poor bioavailability, unstable shelf life, and variable composition depending on how they're grown or extracted. That's why researchers are now working to develop pharmaceutical-grade versions of these herbs' active ingredients, purified, standardized, and sometimes synthesized to ensure consistency and potency. Carnosic acid, rosmarinic acid, and related compounds are being reformulated into capsules, emulsions, or nasal sprays to better reach the brain and pass regulatory hurdles. The goal? To offer plant-based alternatives or adjuncts to conventional dementia drugs that often carry harsh side effects and limited effectiveness. This lab-to-kitchen back-to-lab pipeline reflects a broader trend in medicine, a renewed respect for traditional plants, now validated by molecular science. It also raises an intriguing possibility that some of the most effective tools for cognitive health might not come from a drug company's vault, but from a herb garden that's been growing for centuries. As research deepens and clinical trials grow in scale, rosemary and sage may become more than symbolic gestures of remembrance. They may become legitimate medical tools for protecting the aging brain. So, while scientists in white coats tweak molecules in the lab, Your evening roast with a sprig of rosemary and a dash of sage may be doing more than just tasting good. It might be the humble beginning of tomorrow's cognitive therapy, one bite, one study, and one herbal extract at a time.